In this video, we will discuss how asymmetric information can lead to a problem of moral hazard and why the solution to this problem requires cost-sharing arrangements like deductibles, co-payments, or coinsurance. Moral hazard reflects the notion that in the presence of insurance, people will change their behavior and take more risk. For example, in the context of property insurance, moral hazard exists when the property owner, because of the availability of insurance, is less inclined to protect the property, since the guaranteed payment from the insurer reduces the burden for the owner in case of a disaster. In the example of health insurance, moral hazard can change the behavior in two ways. The insured member can behave in a more risky manner, resulting in negative consequences that the insurance company must pay for. Or it might lead to an overutilization of medical care. An example is where doctors and insured patients agree to do extra tests, which may or may not be necessary. Doctors benefit by avoiding possible malpractice suits. Patients benefit by increased certainty of their medical condition. The cost of extra tests is borne by the insurance company. A solution to the moral hazard problem is cost sharing. The insurer must transfer some of the risk back to the insured member by offering partial coverage or cost sharing. That is, the insurer and the insured member share the costs of medical care expenditures. We already discussed the common cost-sharing arrangements, deductibles, coinsurance, and copays. Here's an example of what moral hazard means in the case of health insurance. Imagine you're coming down with a cold, and when you visit your primary care physician, you're asked to pay $200. Would you still go and see your physician? Or would you try and use some over-the-counter cold medication? When you're insured, health insurance lowers the effective price that you pay for care. Let's say when you're insured, the effective price of the visit is $20. So why not go see your physician? If you think about it, this is simply the law of demand. If we had to pay $200 per visit, we would have fewer visits than if we had to pay $20. So, moral hazard in health insurance refers to the idea that insured individuals increase their consumption of medical care, specifically because they have insurance. What component of insurance makes the price of $200 to come down to $20? It's the coinsurance rate. When your coinsurance rate is 10%, if the visit costs $200, you pay $20 out of pocket. And at $20, you visit your physician, say, 6 times a year. If your coinsurance rate was 20%, you would pay $40 out of pocket, and at $40, you would visit your physician 3 times a year. The key takeaway from this discussion is that the lower the coinsurance rate, the higher is the consumption of medical care. Now let's recall deductibles, the amount you pay for covered healthcare services before your insurance plan starts to pay. For example, with a $1,000 deductible, you pay the first $1,000 of covered services yourself. Once you're done paying your deductible, you usually pay only a copayment or coinsurance for covered services. Your insurance company pays the rest. Now let's look at the demand for medical care under deductibles. We have price on the y-axis and quantity on the x-axis. Here's your insurance contract. It has a $1,000 deductible and a 20% coinsurance rate. Let's assume that every unit of care costs $200. In this case, when you consume 5 units of care, you pay your deductible in full. We can represent the deductible as a rectangle with unit price as its height and the number of units as its base. This is the sum of money you would have to pay out of pocket before your insurance plan starts paying. So the price that members pay in this range is the actual cost of care, $200 per unit. Beyond the first 5 units, the member will pay 20% coinsurance. In this case, $40 for each additional medical care unit the member consumes. And this is the rationale behind the deductible. It is important to note that many plans pay for certain preventive services before one meets their deductible. These services typically include vaccinations, screening checkups, and disease management programs. The reason for that is that insurance plans benefit when health conditions are detected early and addressed using cheaper and less intense measures. For these types of care, the insurance would typically not require a copay or coinsurance, so people pay zero out of pocket. In other words, the insurance company is creating moral hazard for preventive care. If people are generally underutilizing these services, creating moral hazard to increase the use of these services is a good thing.